think it's my turn to have some technical difficulties. Here we go.
Okay. All right. I was wondering if I was supposed to start talking.
No, I
All right.
am going to hopefully start sharing my screen, and then there we go, hopefully. All right. All right, I think we got it now.
Okay, good deal.
Okay, Adrian, would you like
All right.
to kick us off?
Sure thing. Thanks everyone for joining us tonight, and thanks for everyone understanding our switch to this virtual event. Welcome to our Illinois Department of Public Health Healthcare Facility Update. Just a little bit of etiquette here for our webinar. Just, try and stay muted when you're not speaking. If you do feel comfortable, we can turn videos on. We will be monitoring the Q&A chat. So if you have any questions that you'd like Mr. Schmitt to answer, just go ahead and pop those in there, and we'll do our best to get through them in this presentation. Briefly, just want to say thank you to our sponsors, our annual sponsor this year, Schmitt Group, and then our 1869 Circle partners as well. Thanks for all the support. And then our in-kind sponsors also. Okay, so again, in that webinar sign up, if you didn't get a chance to update your or add your AIA number, go ahead and make sure that you email info@aiachicago.com just to make sure that we're receiving all of our credit for this course. Okay, and now just a brief introduction of Dennis. So Dennis is an architect supervisor with the Illinois Department of Public Health. He recently, in 2022, became the division chief for life safety and construction. He works very closely with providers and healthcare architects to assure code compliance within department's licensure requirements and life safety code. He's going to be speaking to us today about all the updates that have come. Dennis, can you take it away?
Yes, can everybody hear me okay? Thank you very much for pivoting on this so quickly. So I know we've had some challenges electronically, but I think we've got it worked out a little bit. So the first screen you'll see up there is the IDPH process. So let's go to the second screen. Next slide. The Division of Life Safety and Construction. Most of you know this, but we kind of tell this a little bit about it because it's, quite a few years old now, but it was established in late 2011. And I actually joined IDPH in April of 2012. So it was brand new to a lot of us here, and especially me joining the office. So, but what it did is it combined the responsibilities of life safety and construction and long-term care licensing or life safety inspections under kind of one umbrella. So this way we had the more control when Henry took over as division chief at that point, more control over how things were being answered, how things were being looked at in the code. So it was a very, very good move back then to do this. So we have two divisions in this section, or in this is the design and construction section and the field services section. Next slide. So this is kind of the org chart we have set up. I'm the division chief, and one of the new announcements is, most of you probably know Laura Kramer. She is now the new supervisor, which was my old position. And after Henry retired, I applied and got his position, and then Laura applied for my old position. And now she's the architect supervisor for design and construction. On the other side is Bill Myers. He is also one of my supervisors, and they do field services, and they do all long-term care federal surveys only. They do not review any drawings or anything. But what I've got on this sheet here, I've in blue highlighted are some of the under the life safety field services. Franco Isaac, Troy Hatterman, Michael Kasdorf, and also at the bottom, Lindsay Hahn. They're all cross-trained in all provider types. So if we need assistance, say where Lindsay's at down in the Edwardsville area to go do a ambulatory surgery recertification survey, he can do that for us. So because as you can see on our side we have limited amount of people here right now, architects and everything. So we're trying to hire more, and I'll go into that a little bit more detail, but we're cross-training. Everybody that's hired from here on out is being cross-trained to do long-term care surveys and also non-long-term care, hospitals, ambulatory surgeries, and hospice residents, stuff like that. So next slide. So these are some of the challenges we face right now, just from a state standpoint in hiring. We are short right now, currently 2 to 3 architects, 2 in Springfield, and we're trying to add another one in West Chicago to help Abul out. So these are some of the challenges we have right now due to retirements. We also are down 3 project designers, but we're trying to hire 1 to 2 project designers just for Springfield. They'd also be trained to do Centers for Medicare surveys and also project inspections. Most of you know Mujib. He is a project designer, so he goes out and does surveys for us still contractually. But we're trying to hire 1 to 2 project designers. And we've also added another field here called an engineering technician 3, which is a level where they have a background in technical studies, some type of engineering, but not necessarily an engineering degree required. Where the project designers required an architectural degree but didn't go for their architectural license, the engineering tech 3s will also be trained, but they are going to be doing more assisted living inspections, assisted living surveys, new projects, and also we're looking at doing that project reviews for assisted living that's being proposed in legislation right now. So they would be working more on that. They may accompany us on surveys because everybody that gets hired also goes through Centers for Medicare and Medicaid training. So that's kind of where we're at with staff positions and what we're trying to hire right now. Next slide should be continuing on with the org chart. Design and construction section, Laura Kramer, as I mentioned, is the new supervisor. Our section of responsibilities in design and construction are plan reviews for all new and renovated healthcare projects in Illinois. We conduct all the on-site inspections for healthcare projects outside of the individuals that were cross-trained that I mentioned earlier. We conduct life safety code surveys on behalf of Centers for Medicare and Medicaid for all non-long-term care facilities. Those are sample validations, recertifications, full surveys due to complaint, and so on. Next slide. Continue with org chart. Field services section, that's Bill Myers, the supervisor. And what they do is they conduct their annual surveys at all long-term care facilities for Centers for Medicare and Medicaid. And they conduct approximately 1,000 long-term care facilities each year with that group that they have. So they're very busy all the time. Next slide. I want to kind of go into a little bit about project submissions, licensed healthcare facilities that are considering construction projects. And every time I do a presentation, I try to let everybody know, we want to know the project because if it's going to be reviewable or non-reviewable. So what we do is we ask everybody, send in a project narrative, send it to the dph.design.standards@illinois.gov, email, put a drawing together, and what we'll do is we try to review everything very promptly, and I'm usually the only one that's reviewing that, so I can make determinations if they're going to be a reviewable, non-reviewable project. Even if there's any doubt what it is, send it in to us, we'll review it, okay? Hard copies of the request can also be emailed to the department, but we prefer the email because it's actually quicker, so in responding, than getting an email, stamping it in, sitting in the inbox, and then Dave gets it, he'll have to hand it off to me after he logs it in, so emails are much easier for us. So, and we make a determination on the project reviewability by the NFPA, the hospital section part 250, and also the nursing home part 300, and also the ASTC part 205. So if there's any doubts, any questions, please email us. Anything you need to have an answer on. Next slide. Project submission timeframes. I want to kind of go through this a little bit more because I think there's some misunderstandings about what some of the submissions mean and what the timeframes are. So I'm going to take a little bit of time to kind of walk through this. When we when a project is submitted to the office, our office administrator, currently Courtney Coy, she receives the project, she'll open it up and verify all the components are there. She has up to 10 working days from receipt of that to deem it acceptable. That means she's checking to make sure the project submission form's there. The fee, if required, is there, and the drawings are all there as specified in the in any documentation that was forwarded. So that's the first 10 days. Most of the time it does not take that 10 days. Then what she does at a period when she is done with that review, she deems it complete, an email sent out that the submission is deemed complete. That means then it's assigned, she is assigning it to one of our architects, including me. I've reviewed drawings too, still, or Henry if he's here, because he's contractual also. He's been doing a lot of drawing reviews during his contractual time for us. But these are the review times that we're having, right? 30 days for stage one, which is design development stage one drawings. And that's by all the AME stuff. So, and currently we have no mechanical, electrical. So we as the architects are reviewing all the mechanical and electrical also with the drawings. And I'll talk about this a little bit too. Stage two drawings, working construction drawings, we have up to 60 days to review it. Some projects take longer than others, depending on the complexity of the projects. But most of the time, they shouldn't take the full 60 days, but there is a caveat to that also. And it depends on federal surveys. Federal surveys that are assigned to us by Centers for Medicare and Medicaid become a mandate, and they, even in our legislation, requires us, they are the first priority, the Centers for Medicare. So unfortunately, if a time frame goes over 30 or over 60, that potentially meant that we had a federal survey that cut into some of that time. So we do them as fast as we can, but unfortunately CMS does call occasionally to go and do full surveys. So, and we'll kind of go through that later, a little bit later. We have 45 days to review any receipt from an architect or engineer, any of the documents that were requested after we do our reviews. We have up to 45 days to re-review those. Typically, they do not take that long, but that's one of those mandated timeframes that we have to tell everybody. We also have the requirements for engineering judgments. We have up to 30 calendar days to, when we receive them, to actually review them and deem them acceptable from a third party on engineering judgments. Next slide.
Excuse me,
Project
Denise.
submission. Yeah.
Hi, this is Denise. I'm one of the, I guess, moderators. We have a question come in that kind of fits right in there.
Yes.
Oh, wait a minute. I'm not so used to monitoring this. Where did this question go? It was about a submission date.
They're asking
Okay,
if
no questions till the end. Okay, sorry, my bad.
Oh, well, okay. We'll wait. Okay, we'll wait to the end then. Is that okay?
Yes, sorry.
All right. Yeah, sure. No problem. Because I've got a question and answer time at the end, so that's not a problem. So let's just remember that one. So these are some of the project submission requirements. Everybody that has submitted to this office pretty much knows these. The correct forms can be found on the IDPH website. One set of stamped signed drawings, specifications by the licensed architect. They do not have to be wet sealed, the drawings. Stage two drawings do not have to be wet sealed either. So we can have nice at level 3 or above for fire alarm, sprinkler, project replacements. In case there's a certificate of need required, that's if it meets the minimum thresholds or adding beds to a certain point. So, but we get into the certificate of need, could be a whole nother presentation on its own. So we won't go too much into that. If there's questions, we can discuss that later. Functional program and systems program narratives have to be in there. It kind of gives us an outline of what we're looking at in the drawings. Plan review fee. If there's no, and this, I want to touch on this a little bit. If there's no fee that comes in with the drawings, they sit there, just so everybody knows, because sometimes we get checks that come in from the provider. Could be the hospital, the ambulatory surgery center, could be come in from somewhere else. Until that check gets here, we do not process any further, okay? Just so you know. The key here is when if another provider, if the provider is providing us a check for the review fee, make sure that you tell them that the check has to be addressed us correctly, but it also has to state what it's for, because you would be surprised how many checks we actually receive in this office, and we don't know what project it's going for because they don't put anything in the memo lines. It's literally a check in an envelope that comes to us. So we're trying to track it down. Maybe we haven't got the project yet. We're trying to match it up with the project, and that does take a lot of time. So please encourage your providers to, if they're sending a check in to us, please tell us what, if it's not in the package, please tell them to put a narrative in there, a cover letter, something that allows us to know what it's going for, okay? And we do not deposit that check until we actually get the drawings here also. So that's another key. So I just wanted to touch on that a little bit. Project submissions are not accepted via email. We're going to talk about that a little bit too. So drawings no larger than 30 by 42, because quite honestly, our review tables are not that big. So we would accept, if they're legible, half-size drawings, if larger than 30 by 42. Next slide. This is kind of a snapshot of some statistics that I literally just pulled yesterday from our database. What we're doing right now is the design and construction section. We're monitoring open projects for construction projects and also centers for Medicare and Medicaid surveys. Right now, ambulatory surgery centers and hospitals make up the most of our open projects. We have 290 open projects right now, currently going on active in the state all over. Long-term care, we have 192 open projects. They could be as simple as a MRI room, CT room, environmental closet, renovations, modifications, all the way up to the large additions at hospitals. So, and we currently have for ambulatory surgery center and hospitals that are under CMS monitoring, meaning we had a survey there and we're monitoring 14 of those too until they can get off monitoring. So our section in the design and construction is very busy with the number of staff we have. We stay busy quite often. So next slide, please. Updates regarding drawing submissions. This is the other kind of big announcement that we're going to do, that we're trying to launch, is we're in the process of updating all our project submission forms. And what we're going to do is we're going to start accepting electronic submissions for drawings. We can't do it through the email because most of the drawing submissions are going to be too large for our email server. So what we have to do is we have to use the architect or engineer's drawing portal, if they have a secure portal for us downloading drawings. And the reason we're starting to head this direction, I've wanted to do this for a couple of years now, because as everybody knows, COVID has changed a lot of things, the way we look at and how we work. So we do have remote days here that are offered to us in this office. So what is nice about, instead of me taking a large set of drawings to my house with me for a review, I can now start using electronic drawings when we get everything set up for reviews in case I need to look at something during a review. I don't have to carry the drawings back and forth with me. So COVID has changed things, and I think for the better. We're trying this. We have terabytes of space available to us now through our DO-IT, Illinois Department of Innovation and Technology. So we have got that hurdle covered right now. We've done some experiments with downloading from FTP sites, stuff like that, and everything seems to be working okay with a few that we've requested. But we're going to change the submission forms to require at least an electronic set of drawings for all projects. Okay, so that's one of the big announcements we're moving forward with. We're still going to have the one hard copy set of drawings so we can leave in the office as review. And we usually, just so everybody knows, we have limited space. We do have a lot of space for drawings, but it's not as much as you would think. But some of these larger projects, huge rolls, take up a lot of space in our area. So what we do is when the project is closed out, we typically go another month, and then we have to take them to shredding, okay? So they are disposed of properly. So, but that helps us purge out The long-term care ones, however, long-term care projects that we're monitoring, the 190 that we have on the shelf, we are having to, we hold those for about a year until the next survey cycle, once Bill Meyer's group goes back and does long-term care, because they could potentially have questions based on a project that we reviewed over in design and construction. So we hold those projects for a year afterwards. So still the one hard copy set of drawings still required. So next slide, please. This is just our main project submission form. This is where you can find it on our life safety and construction. We have been told several months ago that they are trying to update a lot of our web pages, not just our divisions, but other divisions also. And with the state, it does take time to get the process going, the process started. So, so this may change in the future, and we're trying to update some of our information. So when they request it, it's ready to go, including those project submission forms that we're changing. So hopefully most of this stuff will be ready late January, early February for the request of, and you can actually, if projects are being submitted now, you could actually set up and to have us get the drawing, hard copy drawings to us, and then also the electronic drawings now, because we have the space now to store it. So, okay, it's not going to be on the official forms yet. Next slide. Virtual meetings. This is kind of just we can kind of go through this. We used to have in-person meetings at the office that were about an hour and a half long, and with COVID, that changed also. So we are continuing to go no in-person meetings, so we're doing virtual meetings now, similar to this, that we can share screens, show screens. Microsoft, we use a lot of Microsoft Teams and WebEx for our meetings. They're very informal meetings. They're usually for very large projects, complicated systems, stuff like that, that we can sit and kind of get a heads up when it's going to be coming in, stuff like that, so we can prepare staff and who may want to review those drawings. So the meetings were an hour and a half, but we're limiting them to an hour. We are flexible on that a little bit. If it's a larger project, we could add another half hour to our virtual meeting time. Having said that, we're out 45 to 60 days on some of these meeting requests. So if you plan on wanting to have one, make sure you understand that time frame, 45 to 60 days to schedule it. And they're usually scheduled on a Tuesday or Thursday, those meetings. And that's all some of the stuff that we're updating on our webpage also. The provider sets the agenda and is responsible for all meeting minutes. The requirements of scheduling a virtual meeting are located on the division's website. Right now it talks about the in-person one. So if there's any doubt, any questions, please call the office. We'll guide you through it, okay, on how to request one. Next slide. These are what we call interim on-site life safety code inspections. So what this is usually for larger complex projects also. And it's one of these things that has been started several years ago that we do like to do because I think it helps us look at some of these things. We like to see inspections. If we do these, we want to make sure we see above the ceilings before they're installed, because we can look at fire-rated barriers, fire dampers. We like to see the shafts, you know, any shafts that are being enclosed. So that's, and you have to look at the timing on this also, because we need another 45 to 60 days to try to schedule interim on-site inspections, because we do have other project inspections, you know, for finals and final occupancies, temp occupancies that we're going on. So we do need some time. So you have to remember that 45 to 60 day time frame and find out where you're at on your schedule for ceiling installs, drywalls, usually the 2-hour barriers, Chicago vestibules, if you want us to look at those too. So, so that's kind of that on interim on-site inspections. Next slide. Project closeout documents, temporary or final. You typically hear us talk about cert packs, and that's the occupancy certification package. The submissions of the certifications can be found on our website. All the comments have to be, and issues from the occupancy package review must be completed and resolved prior to an on-site inspections. So if we get a cert pack in here that has issues with it, they all need to be, now, it's on a case by case also. If there is a time crunch for something, we can look and see how that impacts the cert pack review and also the on-site request and see where we're at. So we have made accommodations in the past for an emergency need, and say an OR needs to be open, an ED department needs to have another phase looked at, so they can, with this season coming in with COVID and the flu season, it's only going to impact the ED departments at all the hospitals. So, but before any occupancy can be granted, either temporary or final, all the issues must be resolved, okay, at the end, okay? I just want to make sure everybody understands that. Next slide. So this is when we're actually reviewing the occupancy. It's similar to when a project is submitted. Dave Hayes, my administrative assistant, receives the occupancy packages, and he has up to 10 working days to review the package to make sure everything is there. And I want to make sure there's an email that's sent out after he deems everything complete, the fire alarm reports, the sprinkler reports, anything that was required for that temporary or final, he sends something out to, if it's deemed acceptable, we still have up to 45 days where he then assigns it to AME. So one of our architects will review the architecture, mechanical, electrical. They have up to 45 days to review the occupancy cert packs. And a lot of people forget that in trying to plan for openings. However, we are certainly not taking 45 days to review things. We try to get them done a lot quicker than that, but mandated timeframes, we have to tell you that it could take up to 45 days, because also this does impact our federal surveying schedule. These get bumped if we have to go out on federal surveys. So after the review and acceptance, the packet is then received back from the architect that did the review here in this office back to the supervisor, which would be Laura and then Dave, and then they would actually look at scheduling the final. They do Laura would do a final review, and then also Dave then and her would start working on scheduling for getting one of the architects to go out and do an inspection. Next slide. Project inspection request timeframes. So this has kind of continued a little bit. It's a little bit different between each of the provider types, but the rules state that hospitals to be on site, we have 15 working days. And as you can see down here, ambulatory surgery centers, they have 30 calendar days to be on site. So we have between 15 working days on one and 30 calendar days on the other. Nursing homes are also in that 30 calendar days. So even the law has differences between working days and calendar days. So we usually try to meet all of these timeframes, but again, at the bottom, unless a federally mandated survey is required. Next slide, please. Requests for inspection, that's kind of what we've talked about. The cert packs are reviewed for current forms. That's what Dave does. He'll look through it to deem it complete. He'll make sure that all the certifications have signatures. We do not accept type names as if we're typing on the computer, but we are accepting electronic signatures, such as DocuSign. I know there's a few out there. As long as it's an electronic signature that's generated, we would accept those on documents. If there's any question, Dave may call and ask, just to make sure. After the inspection has been initially scheduled, design and construction, they will contact the project architect or engineer to set up the inspection date and time. If there's a balance due for a fee, say the change orders exceeded what the fee was originally, there could be a balance due. We potentially could do an inspection, but no occupancies will be granted until the review fee is received by the department. Okay, next slide. Project inspection, licensure, they're all announced. Only the Centers for Medicare surveys at hospitals are unannounced. All right, but we in licensure always announce our inspections because we want as many people there as that we can have for the contractors to the architects. Who should be at the inspection? Not required, because we can't mandate anybody to be there, but certainly the owner, architect, engineer of record, the contractor, and any subcontractors. After the on-site inspection is conducted, a letter would be from the sent to the architect or engineer outlining any deficiencies that we may have found on site. And we have to have that letter out within 5 working days. Most of the time, the corrections are made certainly by the time we get back to the office, if it's traveling from Chicago. So you send us an email, and the letter may not go out if you've taken pictures of the, depends on what it was. If you have a work order, change order, something that you can forward to us with photographs, we would accept those. The provider, if you got a letter from us outlining deficiencies, have it reviewed back to us within 3 days or 5 days. Occupancy will not be granted until all the deficiencies that were cited during the inspection are corrected. Occupancies are issued by the section supervisor, so Laura would deem everything complete and tell Dave to issue the either temporary or final occupancy. Next slide. Temporary occupancies, this is a pretty easy one to go by. Some of them have many temporary occupancies on a project, but they're typically issued for phased projects. Each of those phases must be in full compliance with the licensing requirements, and that's one of those things that if a phase 1 and phase 2 are complete, but 3, 4, and 5 are not, but the sprinkler system hasn't been done in 1 and 2, we cannot grant occupancy unless the sprinkler requirements are met and the fire alarm requirements are met. So I just want to make sure everybody understands that. Most jurisdictions also would be looking at that too if they're trying to grant occupancy. The design and construction site must receive and accept the temporary occupant checklists. So, and also the same thing for the final occupancy. It will be determined if an on-site inspection is required. So it would be Laura or myself looking at something and deeming it, do we need to go out and look at this if it's a first phase, second phase? I will tell you that if it's a multi-phase project, we typically like to try and go out on the first phase so we can kind of see how everything's flowing during construction. Then we may be able to skip a couple if it's non-patient care areas. We may be able to skip an area and then come out on phase 3 or 4. We do like to see patient care areas for temporary occupancies, just so you know. Next slide. So we're going to kind of go through, I think I only have 3 slides here for federal survey process. The types of surveys that we do is sample validations, recertifications, full surveys due to complaint, and we do monitoring surveys that are after a full survey, but they need to be monitored, the facility needs to be monitored that they are meeting their mandated timeframes that they put together in their plan of correction. Next slide. The facilities will be surveyed under, of course, the NFPA 101 Life Safety Code. The 2012 edition is still what the Centers for Medicare and Medicaid has established. There may be talk in the near future of them maybe looking at upgrading to another code year, but that has not been put in writing yet, so we're still waiting on that. So everything's certainly buildings and additions that were built before July 5th of 2016, and that date is when CMS actually adopted it, the code, and that's why we then as the state adopted the same 2012 edition. So other occupancy chapters that may be looked at during surveys and federal surveys for outbuildings could be, there could be an ASC that's tied to the hospital. So we would look at chapters 20 or 21, depending on how new they are, and also chapters 38 and 39. Next slide. These are just some of the things that we look at when we do our document review and our walkthrough of the building. We do look at fire drills all the way through the fire damper inspections and documentation. We don't need to go through all of these, but all the facilities usually have these that have kitchen hood suppressions. Next slide. one of the larger things that's out there that does take a little bit of time is the emergency preparedness that we require to sit with the facility, whoever is in charge of their emergency preparedness documentation. So we'll sit and make sure they have all the four main categories, the risk assessment, policies and procedures, the communication plan, which is a big one, and training and testing, which is another big one. We're finding that a lot of the smaller jurisdictions, smaller county, the hospitals, the critical access hospitals, that it's more challenging for them to do training and testing because they don't have the size of facilities that are around in a larger populated area where they can do training amongst a bunch of hospitals or groups. So that's some of the Appendix Z is where all the emergency preparedness is found for Centers for Medicare and Medicaid. Next slide. I have a couple slides here with some information, scoops of information. The provider is fully responsible for all compliance with the Life Safety Code. IDPH conducts a sampling of regulatory requirements during a Centers for Medicare and Medicaid survey. We cannot get above every ceiling tile. We cannot certainly check every door, every fire-rated damper, shafts, due to time constraints and also staffing limitations and how long we're actually on site. Next slide, scoop 2, plumbing inspections, approvals must, when we receive these go back to the project submissions, or the cert packs that we were received for final occupancy. We do require a plumbing inspection, and it can be a local plumbing inspector. It could be a state of Illinois plumbing inspector from the Environmental Health Division, but it's not required. As long as we get an inspection from a jurisdiction that is signing off on the plumbing inspection, we would accept that. However, sometimes you may have overlap where an Illinois state plumbing inspector from the IDPH Environmental Health may also be on site, and they may have a separate set of documents. And we have had challenges with that. Many of you know that we do, and we have tried to work through those with environmental health as best we can. So that's on a case-by-case basis. If I need to get involved, I will ask environmental health to step in with their comments if something does not seem correct on a Illinois state plumbing inspection, so report. So let's go to the next slide. Scoop 3, this is just an FSES. Some of the older facilities that we do survey, even in long-term care, we have some FSESs out there trying to bring into compliance through the numeric values that a building is safe. So, and Centers for Medicare and Medicaid does accept existing facilities to have an FSES. We will not accept an FSES for a new building, okay? So just, we want to make sure, because that has happened in the past, that somebody had presented an FSES prior to me arriving at the state, but an FSES was submitted with a new construction package. So that would not be acceptable. So next slide. These are some of the division contact information we have. Most of you have our number, email addresses if you need to get on long-term care. If you're working on a plan of correction for long-term care facilities, that's the field services section number and their email address. And that is the Bill Myers section there. Next slide, we're going to go into some the website information. You can find all our forms, which we are trying to update. Next slide, we're going to go into some of the, and many of you have probably seen these in the past, so we're going to look at no facilities were named in these photos. So it's kind of just things, observations that we have seen over the years to kind of let everybody know what we're looking at when we do federal surveys, issues that we note during walkthroughs, stuff like that. So we'll get into the first slide. This is one we've had on for a few years. It's the always having the sprinkler gauge that's buried partially into the ceiling, mudding, drywalling. They tried to fire rate around it. So we don't like to see that. We applaud them for writing the date on there of the gauge date, at least. Next slide. This slide was actually taken from a failed 3-year sprinkler test, because over time the discharge port was getting less and less. I mean, the time was increasing to get water out, and then it became a trickle. Well, their internal inspection of the piping showed this. So this is always a concern with older systems of buildup inside. Next slide. This was one that was actually at an assisted living facility. We just need to make sure if somebody sees this at a facility, we try to train any providers. If they see this, please let maintenance know if they need to have that, because it may not be accurate anymore with smoke detection at the ceiling because it's hanging down from the ceiling. It may take a delay of alarming the building. Next slide, we also have another smoke detector, lint covering it. In those areas, usually of high area, is usually in the laundry areas. So make sure all the smoke detectors are clean. We do see this quite often. And we also see this with sprinkler heads. And we'll have a couple photos of sprinklers later too. This is another one. They took all the time to cut around the crown molding for that smoke detector in the wall. But that is in violation of the NFPA 72. Next slide. We have a bagged up smoke detector that would read nothing, no smoke, anything, because it's been bagged up. Next slide. Looking in the stairway, no storage of any kind. They have to get that ladder out of there. We do find this occasionally. Next slide. Hiding of exits. It's actually an exit door, but it has blinds on it, so in an emergency, nobody can see the outside, nobody can see the door, so that is violation. Next slide. Construction project with an exit door to nowhere down the side of a hill. That's always a problem, so make sure and that's one of the things that we actually review when we do project reviews, is we're trying to see how the path of travel for emergency exiting is reworked during a construction project. So that is something we would look at, but that's certainly a concern, and that door was actually an active exit. Next slide, electrical panels. We do see this quite a few times where they actually have no panel cover on there, and they're actually wiring from the front of the panel. That is absolutely a violation. And they don't have the proper connections between cabling going from one panel to the other. Next slide. This is something we would see actually in a final above ceiling inspection. And to be fair on this slide, this picture was taken, they were working with the fire alarm, installing the fire alarm, and also some of the electrical wiring. They just haven't put in all of the final covers yet. But this is what we also note when we're doing the final above ceiling inspections. Next slide. Redoing a toilet rooms on a floor, and the contractor left their cutting materials, ceramic cutting, and all their grouting materials in the exit stairway and blocking the exit when they left for the evening. So that is a violation also. Next slide. Exit deliveries, at least the delivery is on a movable cart that can be moved out of the way, but we usually look at this that they have a limited amount of time in which to remove all the boxes and get them stored and out of the exit path. Because you don't want to move it over in front of the electrical panel, because that's a violation too. So it's a catch-22 on this slide. Next slide is one of our favorites. Is it an exit? Is it an emergency exit only, or is it not an exit? Well, we know it is a emergency exit because it does have a pull station there. So what we have is signage that isn't appropriate for what it's set up for. So you cannot have all that signage on there, and yet it be a mandated emergency exit. It can be emergency exit only, but not an exit is confusing. This is always a favorite that we see. Next slide. The GFS can, it's a drip can above the ceiling. If it's dripping and it's on the ceiling, they need to correct or check that valve, replace that valve. We do see that occasionally. Next slide. We just had a unit fire in a skilled nursing facility that one of these caught on fire, and this is not the facility, but you can clearly see what potentially happens. The buildup, they never get in there to clean those out, and look at all the garbage that's in there over the years. Next slide. Air handling units. The actual, kind of interesting because the airflow is going from left to right because the filters are all dirty, but yet that filter fell out back. So, but it's just a matter of maintenance on the filters. Those static pressures had to have been very high on this until that fell out, and then all of a sudden the static pressures are way too, because it's letting free air through. Next slide. Storage in stairways, not acceptable. Next slide. Including the post office part cannot be chained underneath the exit stair. Next slide. Some sprinkler items coming up here. This was one that was actually taken in an assisted living facility in the kitchen, which is they use and I'm going to use the term expanding foam to seal up in the attic space around this thing. Twofold is, one, the expanding foam is combustible and should not be used in construction for commercial construction, and it's also blocking part of the vial to activate the sprinkler head. Next slide. They put the cover over the sprinkler head to protect the vial for painting, but yet they didn't cover the actual deflector, so that sprinkler head must be replaced now because the deflector has been painted over, and they didn't remove the cover. Next slide. Improper support of sprinkler piping. This is not acceptable by NFPA 13. So it's just one of those things that wood could be knocked out from underneath that sprinkler support and damage the sprinkler over time. Next slide. Always know where the staging area is on a construction project, because they put right up next to an exit from the building, the dumpster right next to the exit to the building. So that is a violation. You're blocking an exit. So next slide. Now we'll kind of go through questions, everybody. So anybody that's got questions, I'm ready.
Great. Well, thank you, Dennis. Covered a lot of information, and so thank you so much. Adrian, I think you've been monitoring the questions throughout the presentation. Do we have a few for Dennis we could read off to him?
Yes, so one coming from Lawrence Wilson here. It's asking if no fee needed until IDPH says a particular project needs to be reviewed, correct? I think he's asking to make sure that there's no, required fee unless IDPH says that the project has to be reviewed.
Correct. Yeah, for us making, like, say, a determination if it's a reviewable project, no, there's no fees. The only time we receive a fee is if it hits the thresholds for hospitals. That's something else we didn't talk about is quickly. Hospitals, the threshold for projects submissions is the project reviews fee is $500,000. If it hits that threshold, then a project review fee is required. If it's under 500, doesn't mean there's no review fee, doesn't mean that there's not a project submission, but there's no project review fee under 500,000, okay? Long-term care is $100,000, okay? So anything over 100,000 on long-term care requires a fee to be assigned, okay? But that's only when the project project forms are filled out and submitted to the office, okay? And also on those review fees, we have up to 24 hours. If it's in the package, we have to deposit those checks within 24 hours of receiving them. Okay, we're mandated to do that. Having said that, we've had people cancel the project 10 days after, and we've already submitted it, and it is a nightmare to get money back from the state, just so you know, okay? So it needs to be a viable project, because it may take some time to get the money back if the project is canceled. If we go through our first set of reviews, stage 1 or stage 2, the money is not coming back, just so you know, okay? Because we've already expended the time and effort to start the review process, okay? So I want to make sure everybody's clear and understands that, okay?
Okay, thank you.
I hope that answers the question.
I think it did. The second one here, Illinois is only one of 4 remaining states that do not require compliance with some addition of FGI. Are there any plans in the future for IDPH to require compliance?
No, we are not going to adopt the FGI guidelines, because we are one of the few states that actually have very detailed rules and regulations to follow. And if there is something that we do not have in our rules and regs, we would permit somebody to come back and say, FGI has this, would you accept it? So we have reviewed it based on that, but no, we have a very, even Texas does not have guidance for specifics for outlining hospital or long-term care facilities, but we have very good regulations that we are in the process. That's one of the other things. We're in the process of updating over the next year also to bring things more current. From some of them are sitting out there 20 years old in our rules. So, but no, FGI guidelines is not going to be adopted anytime soon in the state of Illinois due to our extensive rules.
Okay. Thank you for that clarification. Then a couple more here. And I think is IDPH planning on joining the Joint Commission during their regular accreditation surveys?
No, I have not been guided from Centers for Medicare and Medicaid on any of that. So I can say right now I have heard nothing about that.
And no other third party, outside of Joint Commission,
No,
correct?
no, we are independent. We do, when CMS asks us to do our survey, we do the survey. We don't go with anybody else to do a survey or a mock survey, anything like that. I hope that answers the question if I understood it correctly.
Okay, and then I see someone has a hand raised. David Daster. Is that a question?
David Daster?
Yeah. You should type the question into the Q&A, please.
Okay, and while he's doing that, we have someone's asking, we have some owners, clients that say that Joint Commission is going to require them to follow FGI. Thoughts on how that affects projects in Illinois? If an owner says that they are required to be following FGI, what are your thoughts on how that affects projects in Illinois?
I don't know who would be requiring anybody to follow FGI. If it is a licensed facility in the state of Illinois that IDPH license, they will be following our rules and regs that we have established. Part 250, Part 300 for long-term care. All the parts, they will be following those and not FGI.
So even if Joint
Because
Commission,
that's what we would review those projects under our rules, regs, and NFPA. So I'm not sure who would be requiring, if a city or local jurisdiction saying FGI, they still have to comply with the requirements that who's licensing them, and also the Centers for Medicare and Medicaid, who's paying a portion of their money that comes into the facility.
and they were specifically asking for Joint Commission, but I think this applies to, all others as well. Anything else?
Yeah, right.
Okay.
I think we have time for one more, Adrian, and then we're gonna start wrapping up.
Let's see here. Okay, one more here.
Yeah.
Are there any updates planned in the future for Section 250?
Yes, there are plans for updating the licensure requirements. And it's not just 250, it's the ambulatory surgery one has already had some updates. Our upper management has focused on certain tasks that we want to try and bring into more current regs, okay? Certainly they start with long-term care because that's the most facilities in the state. Long-term care is being updated. We've updated some of the ambulatory surgery requirements. Hospitals are next. There's a lot of stuff that many of you know the name Karen Singer, health facilities and programs, or healthcare facilities and programs. She takes care of a lot of those rules and regs in those sections. The ones that require the life safety side of things for the architects, we are over the next year starting to review. In fact, Laura and I just had a meeting about this a couple weeks ago, that we are going to each take sections, including Eric, Abul. We're all going to take sections to start looking at them, what we're seeing in the field, what we've seen, comments we've heard from providers, comments we've heard from the architects and engineers for projects. And we're going to start trying to update some of this and include interventional radiology is a big one that we have no real guidance for within the hospital. So we've got sections already started. I've started typing on interventional radiology. So yes, over the next year, we're starting to work on updating our licensure rules. And with anything that does in the state of Illinois, it does take a little bit of time, not so much on our side to make changes, but it has to go through what we call JCAR, and it's our the joint. They look at all the rules and regs for everything, and it has to go through them, which goes ultimately through the governor's office. So it does take some time to update stuff, but yes, that is something is going to happen under Part 250.
Okay, perfect.
All right.
Thank you so much for your time. Thank you everyone for these questions.
And
Yes.
everybody knows they can still email our office with other questions that may come up after this. We're very open on answering email questions. Okay, I want everybody to make sure they understand that.
Dennis, are you comfortable sharing your PowerPoint presentation?
Absolutely. You guys can share what I sent to you. Absolutely, it's shareable. Okay.
Thank you.
Yeah, not a problem.
Okay, well, thank you, everyone. In the interest of time, we're going to go ahead and close out our presentation. Thank you so much to Dennis for taking the time to pull together all the valuable information to share with our healthcare knowledge community. This presentation actually concludes our 2023 educational series for the year. We are looking forward to 2024 with all of you. We do have our annual New Year party coming up in January. Look for information on that. We will be Kimball International will be hosting us again this year, and we're very much looking forward to putting together our annual slide presentation of all of the projects and wonderful things that we've accomplished in 2023, and looking towards all that we will accomplish together in 2024. In addition to that, we are going to begin accepting our call for nomination to be part of this leadership team. So please look out for that information as well. Allison, I think we are prepared to close out the presentation. Do you have any final remarks for us?
No, it was terrific. Thank you so much. Glad we got everything worked out, and yeah, looking forward to 2024.
All right, great. Thank you, everyone.
Thank you. Bye-bye.
Thank you.
Bye.
Bye.
Thanks, Dennis.